Hello, good evening. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. This evening, it's very important for so many reasons. This evening, we're going to talk about malaria. Malaria, a deadly disease which can affect your fertility, both for the females and the males, and can also have adverse effects on pregnancy. So malaria effect, the burden of malaria, the need for prevention, the effect of malaria on fertility, and also the effect of malaria on pregnancy. So please, once you join, I will want to know who you are. So introduce yourself. My name is Dr. Chudi Ufondu. I'm the convener of this group. And this evening, you will have opportunity to know a little bit more about malaria. So you'll be more careful. You know, it's very easy to consider everything malaria when they are actually not malaria, especially in pregnancy. Malaria can complicate your pregnancy in so many ways. COO, thank you so much for joining. Let's see if any other person can join before I start. This is a very important topic for so many reasons. So I encourage you to share this particular video, subscribe to this channel, check old videos, make your comments, ask your questions. We will always be there for you. Every Tuesdays about this time, 6:30 p.m. Eastern Time US, 11:30 p.m. Nigerian time. When you show up on this channel, you will see me talking about the topics I love talking about, and you will definitely also see COO also talking about the importance of health. That's all we care for. So please make yourself comfortable, and I'm going to start my presentation very, very soon. I'm actually going to start because we have a lot of things to talk about. So malaria, unfortunately, is a burden which it's really causing a lot of havoc in developing countries. Thankfully, in developed countries, they've actually eradicated malaria. Unfortunately, in developing countries like Nigeria, malaria is still causing havoc. Malaria is the biggest killer among pregnant women and kids under 5. The impact of malaria is indescribable. Probably you might not have had that experience with malaria, but unfortunately, malaria can affect your fertility. Malaria can affect the fertility of a male. Malaria can affect the fertility of a female. And malaria can also affect pregnancy. Malaria affects both the reproductive system of men and women. In Africa, we bear the 90% of burden of malaria. So Africa bears 90% of world's burden of malaria. So think about that. So we have the 90%, then the other 10% is distributed around Asia and a couple of other places. But developed countries, they have succeeded in eradicating malaria. Now, pregnant women and children in Africa are particularly vulnerable to the adverse consequences of poorly treated malaria, poorly diagnosed malaria. Thankfully, the World Health Organization is trying to look into different ways of preventing malaria, because if we can prevent malaria, then we would have gained a lot of upper hand. Pregnant women in malaria-endemic regions. So malaria-endemic region means you live in a place that virtually, people around that area develop malaria. And the good thing is, when you live in malaria-endemic region, that means the burden of malaria in that particular region is a lot. You might develop immunity. Let me give you an example. When I came to America, I needed to take prophylaxis before leaving Nigeria and while I was in America. The reason is because as you are changing different locations, especially intercontinental changes, there are changes in your immunity. Someone that lives in America for a long time that has not been bitten by mosquito, when you go to Nigeria, when you're bitten by mosquito, you can have severe malaria infection. But people that live in Nigeria that get bitten by mosquito can develop malaria and their immune system can handle it. So you develop kind of an immunity if you live in areas that have frequency of malaria. So in doing this, your body will get kind of accustomed to malaria to an extent that you guys might have a good relationship. But if you have not been bitten by mosquito, if you have not suffered malaria, the first time you will suffer malaria can be deadly, especially in pregnancy. Now, do you know that in as much as it might be rare, malaria can affect the semen quality? So your partner, if he develops malaria, if it's not properly diagnosed, he can develop problems which can affect the sperm. So if your man is suffering from high-grade fever due to Plasmodium falciparum, Plasmodium falciparum is the malaria parasite. That high-grade fever can affect the sperm production. So men that have acute malaria, which presents with high-grade fever, can suffer severe azoospermia. Azoospermia means that time they have that malaria, they don't have sperm. Some men can also have what we call necroazoospermia. So when you have necroazoospermia, it means you have a lot of sperm that are dead. These are not fictions. It can happen. So if your partner is currently having fever, it's possible he's properly treated. If you guys are believing God to have a baby when your partner is having fever, the possibility of becoming pregnant will be limited because that high-grade fever can affect the sperm. So within that time your partner is having this high-grade fever, you guys will have temporal infertility. Thankfully, once the malaria is properly treated, your fertility can bounce back. Now, in most cases, recovery will happen almost immediately. So if you are planning to have a baby and your partner is diagnosed of malaria, it's important it's properly treated before you guys will start believing of a baby. Malaria can also affect the air quality in a woman. I'm sure this is the first time you're hearing this and you'll be wondering, are you kidding me? Correct. Malaria can affect your air quality. Now, when you are diagnosed with malaria in pregnancy, it can affect the mother and it can affect the baby. There are a couple of things that can happen to the baby. Now, we need more research to know exactly the impact and the burden of malaria on both the male, the female, and the baby. Now, presently, malaria affects people in more than 100 countries in the world, including Nigeria. Now, there are various health effects of malaria infection, and even the treatment can cause a lot of problems. Now, so many people might not be aware of all these problems that malaria can cause. Now, apart from the malaria itself, in pregnancy, it's not all malaria drug that you can take. There are some malaria drugs that can have their own adverse effect and can affect negatively the pregnancy you're carrying. So there are some malaria drugs which you cannot take in a particular trimester in pregnancy. There are some specific anti-malaria you can take in first trimester. There are some specific anti-malaria you can take in second trimester. And there are some specific anti-malaria you can take in third trimester. If you take the ones you're not supposed to take in first trimester, you can have problems, including losing your baby. This is serious. Now, generally, for women that live in malaria-endemic region, they are supposed to be commenced on anti-malaria prophylaxis. Prophylaxis means you might not have malaria, but we are worried and we are thinking that you might be exposed to having malaria. So what we will do is to give you an anti-malaria ahead on time. If you're conversant with what our parents gave us when we were growing up, they gave us Sunday medicine. That Sunday medicine is a type of prophylaxis. So ahead on time to prevent us from developing malaria. Now, because women that live in malaria-endemic region can be exposed to mosquito bites, mosquito, it's the female Anopheles mosquito, it's the vector. That's the carrier of the Plasmodium falciparum, which is the commonest species of malaria parasite that can cause problems. So we need to be careful. Now, when you are taking quinine and chloroquine, which are the commonest anti-malaria and the cheapest one out there, they can affect the blood level of some reproductive hormones, especially follicular stimulating hormone and testosterone, than luteinizing hormone. So we need to be more mindful. So what are the specific effects of malaria in pregnancy? Unfortunately, in some women during pregnancy, if they don't take their prophylactic, for malaria, and they become pregnant and they have malaria, they can have miscarriage. So when you develop malaria in pregnancy, you can have miscarriage. Miscarriage is the unintended end of your pregnancy before 20 weeks. So majority of women that live in Africa that might have experienced miscarriage, we need to probe further, because malaria as an independent entity can lead to abortions and miscarriage. Now, malaria can also lead to unexpected problems of infertility down the lane. Malaria can lead to having a baby that will be low birth weight. Malaria can lead to early delivery of your baby through the process of prematurity. It's important that malaria is not ignored because they can cause a lot of problems. Thankfully, by taking specific drugs, which your antenatal care doctor can give you, you might be lucky. Malaria can end your pregnancy. So it is important that when you are pregnant, you register for ANC on time. Pregnant women are even at risk of dying from severe malaria disease if they develop anemia. So malaria itself can cause anemia in pregnancy. And when you have anemia in pregnancy, anemia simply means you don't have enough hemoglobin. Hemoglobin is the oxygen carrying capacity in your blood. So when you don't have enough oxygen carrying capacity, your organs can fail and you can die. So malaria can lead to death in women in pregnancy. So we need to do everything possible to make sure that we control malaria during pregnancy. If you have overwhelming malaria infection that affects the placenta, then that woman will likely have a lot of complications, including the death of the baby, either during delivery or subsequently after delivery. Because what happens to you in pregnancy will affect your baby. If you have a very healthy pregnancy, your baby is going to be healthy. If you have a troublesome pregnancy, your baby is going to have problems. This is why when you are pregnant, you must stay with a doctor that will look after you for that 9 months. It's important. Pregnancy is not the time to be smart. Pregnancy is the time to be wise. So despite all these extraordinary problems we have with pregnancy, unfortunately, malaria remains the biggest killer of women and kids under age 5. Despite the modern technologies, despite the preaching about ANC, there are some women, as I'm talking to you, every second a woman is dying from malaria, which was not treated because the woman didn't go for prophylaxis. A kid below 5 is dying as I'm talking to you from malaria, something we can collectively prevent. So it's important we embrace all the different preventive measures, like using insecticide-treated nets, by taking your prophylaxis, by clearing your environment so you can curb the effect of mosquito, by being aware and being conscious, by going to your doctor when you develop symptoms. Remember, it's not all fever that mean you have malaria. There are some fever that might mean you have other infections. And please stop self-medication. When you go about taking malaria drugs every 2 weeks, you are not helping yourself because you are not doing the right things and you can develop resistance. So if you have a need to receive appropriate treatment of malaria in the future, because you have abused the anti-malaria, your body is now used to those anti-malaria, so you will develop resistance. The same thing can happen to people that take antibiotics. So please, the habit of treating malaria every 2 weeks in Nigeria should stop. This is a battle that has even permeated my own family. We battle a lot. By the time you're touching base with people in Nigeria, they will say, oh, I have malaria. I treated malaria every 2 weeks. That's not good. The only person that should diagnose malaria and give you appropriate anti-malaria is your doctor. Please. The best thing you can do is to prevent developing malaria by making sure that your environment environment is clean, treated nets. Now, if you can't do it for yourself, please make sure you do it for your pregnant woman. It's important. You are protecting that woman, you're protecting your baby. And if your baby did not develop properly, your baby will struggle. There are some babies that will have what we call failure to thrive because when they were in their mother's womb, they didn't enjoy anything. And when they come into this world, they begin to suffer. So please be careful. Malaria is still deadly. Malaria is still the biggest burden in developing countries, including Nigeria. This is my presentation. And at this juncture, I'm going to collapse the clinic so we can start taking questions. It looks like people are coming in and they are leaving because it's not your butter and bread, okay? But I still have my COO, amazing lady. So COO, let's talk. Hit me up. Ask me questions, please. Immediately after this clinic, we are going to go to Facebook and we'll continue the conversation there. So please take this serious. You see, our group is not a quick fix. Any topic you see me choosing in this group is a topic that is very relevant. Now, it might not be your popular topic, but please pay attention to, everything I teach you guys in this clinic. So please keep asking your questions. Ask your questions. Feel free. Remember to join us on the 28th for our mega masterclass. We will concentrate on IVF, IUI, and surrogacy. Correct. Malaria vaccine. So thankfully, how did I forget that? Thankfully, as I'm talking to you guys now, they have developed malaria vaccine. And it's a bridge over troubled water. If we can eradicate malaria in developed countries, the world will be a better place. The mortality rate, the infant mortality rate, the morbidity rate will reduce. So thankfully, hopefully, the ongoing malaria vaccine they have developed, by the special grace of God, by the time it's gone through different phases of trial, it will be effective, just like we eradicated polio, just like we eradicated smallpox. Hopefully, malaria vaccine will be the bridge over troubled water. So malaria vaccine simply means we can actually inoculate your body with this particular vaccine, and your body will ward off developing malaria. When you receive vaccine, part of that vaccine can actually be part of that particular thing you're trying to prevent. So there are different types of vaccine, like flu vaccine, like COVID vaccine. When you receive a vaccine, your body can react in different ways, but over time, when you eventually get exposed to that organism, you will be protected. That's the function of vaccines. So growing up, you know, your parents gave you a lot of vaccines. That's why you made it. That's why you didn't die. That's why you are still able to go to university and become somebody, because of all those vaccines that your mother, oral polio, BCG, and all that. I'm sure so many of us still have a mark of vaccines on our deltoid muscles. These are all the things our parents did for us so we can become better. So if you have an opportunity and you're offered the malaria vaccine, it's protective. Anytime you hear about vaccine, please embrace them. That's the reason why so many people are still standing. Don't fight what you don't understand. The best you can do is to ask questions, okay? I love that question. What are some of the ways a pregnant woman can safeguard herself from malaria? Personal hygiene, using insecticide-treated nets. When you use insecticide-treated nets, you are preventing the barrier between you and mosquito. The causative agent of malaria is the female Anopheles mosquito. The malaria parasite itself, the popular one, the commonest one is called Plasmodium falciparum. If you can prevent the contact from, attacking you, which is the malaria, which is the mosquito, then you've done a lot. Definitely take your prophylaxis. So in developing countries like Nigeria, once you are pregnant, you must take your anti-malaria prophylaxis. You cannot afford not to take it. You have to take it. Now, if you develop malaria, it's important it's treated appropriately. Some people will quickly stop taking their medications once the symptoms are gone. That's not good. If I ask you to take a drug for 5 days, please take that drug for 5 days. Don't stop at day 2 when you no longer have symptoms. Take it for exactly 5 days. Because when the symptoms are done physically, inside of you, you must still have some problems. So these are the two major areas of preventive measures we can use in preventing developing malaria during pregnancy. We don't even want you to develop it at all. Okay? All right. Is malaria medicine treatment same for children and adults? No. No. Anytime you're taking any drug, it's important you pay attention to the dosage and route of administration. So kiddies can have lower dosage of anti-malaria. Kiddies can take syrup. Kiddies can take suppositories. Adults can take, the capsules, injections, IV fluids that will be superimposed with anti-malaria medications. So the route and the number and the quantity and the strength of the anti-malaria that children can take will not be the same with adults. If you give a kid a dose of anti-malaria that an adult will take, that kid is going to have problems, including death. If you give an adult a dose that a kid will have, it will not be effective. So you might have, a malaria disease that won't be properly treated. I love this question. I don't know where this lady gets all these technical, very important questions. Please keep asking. Keep asking. So hopefully, since we have fewer people in the clinic, we will be rounding up in a few minutes. Is it true that AA genotype individuals suffer more from malaria? Somewhat true. Somehow. So for some reason, the sickle cell gene, which some people can have as straight, and some people can actually have sickle cell. That means when you have SS, it means you have two sickle cell traits. So you have a sickle cell disease. But when you have AS, it means you have the trait only. You're a carrier. Now, for some strange reasons, people that have the sickle cell traits tend to have a kind of immunity. They are protected more from having malaria compared to people that have AA. So malaria parasite, which is Plasmodium falciparum, loves AA and hates the sickle cell. Do you know what I mean? So if you pay attention when you were probably in developed countries or you're still in developed countries, if your genotype is AS, or if you're AS, or if you're SS, you are less likely to contract malaria compared to someone that is AA. Now, here's the problem. When you eventually contract malaria as a sickle cell person, it's deadlier. So you can have more severe infection of malaria if you have a sickle cell, if you have a sickle cell trait, if you develop it. But you are more protected from having it. But if you develop malaria as a sickler, you're in problem because you will have a lot of challenges. But malaria affects people that are AA much more than people that are not AA for some reasons. Beautiful questions from Kenneth. Okay, guys, do you still have any question? If you have more questions, please feel free to ask before I adjourn the clinic. Very poor outing, only 2 people in the clinic for a very important topic like this. Okay, Charles, if I'm correct, are you the Charles from my alma mater? I want to believe it's the same guy, okay? Also, sometimes you do go for tests in the lab before taking malaria drugs. The lab guy advises you then to go to pharmacy. Of course, that's self-medication. You don't go to the lab without seeing a doctor. That's wrong on so many levels. And that's the that's the commoner practice in Nigeria. You are wasting your resources. You are wasting your time. You are not helping that particular thing you're trying to correct. The right thing to do is to see a doctor. Don't go to the labs. I'm not trying to spoil business for the lab people, but please be careful. Have you not noticed that anytime you have contact with the lab people, they will convince you to run out the test you don't need? They will even put fear in you. They will even give you the diagnosis. They will even give you the prescription. That's not real practice. I know you guys will say, but doc, you don't live in Nigeria, you live in America, and you don't understand. I understand. You are not helping yourself. So, Charles, stop going to the lab first. Go to the doctor. Let the doctor prescribe the lab you need. When you go to the lab, stick to the exact thing your doctor wants you to do. So if I want you to go for your malaria parasite lab investigations, please, when you go there, do your malaria parasite lab investigations. Don't allow anybody to do wild tests for you. Because the common thing, oh, you have typhoid, oh, do this, do that, they will begin to siphon the little money you have. Now, when you're done with those labs, please take the report to me. I will interpret, then I will discover what's going on. Then I will give you the specific drugs based on what will work for you. It's not all people that can take up anti-malaria. There are some people that have adverse effect to chloroquine. Like I can't take anything queen because the itching is out of this world. But I can take artesunate. So please, let's stop that habit of self-medicating. It's not good. Now, a pharmacist has his role in the health sector. It's not the duty of a pharmacist to make diagnosis. In some developed countries like America, good. Some pharmacists can prescribe, they can diagnose. Some nurses can prescribe, they can diagnose. Some physician assistants can do that. But in developing countries, please rely on your doctors. I know why I'm saying this. Anybody that has contact with the medical facilities will, oh, I'm in the hospital, please take this, take that. By the time it's now bad, you start going to the doctor you should have gone to in the first place. Let's obey simple chain of command. Go to the doctors first. Okay? So Charles, you're the same guy. Great job. So Charles, it's an amazing guy. He's been doing all these designs and pretty much doing a good job. So Charles, make sure you share this video with your community, and it's good to see you in the clinic. If you have any other questions, please feel free and ask before I go. Of course, if you're looking for a baby and you go to the lab by yourself, they will tell you you have Staphylococcus aureus. And they will also tell you you have Candida. And they will tell you that the reason why you don't have a baby is because you have staph and Candida. Unfortunately, it's not true. Staph cannot cause infertility. Candida cannot cause infertility. They are not even sexually transmitted. There are so many things you don't know. But, you know, when you're exposed to falsehood to some people, over time, it will become like the truth to some people. The truth can be always true. You can never move away from the truth, okay? All right. Thank you so much. At this juncture, I believe we've done justice to malaria. And I'll see you guys on Saturday. The next clinic is going to be on Saturday. Saturdays are a little bit early. Lately, we've been running the clinic on Saturdays by 1 p.m. 1 p.m. Eastern Time, US, which will be your 6 p.m. in Nigeria. So show up in this clinic, and immediately after this clinic, we will normally go to Facebook. So join me in Facebook in a few minutes, and we'll continue the conversation. Until I see you, thank you so much, Charles, for coming. Thank you, COO. God bless you guys, and enjoy the rest of your evening. Bye-bye for now.